You're listening to Health Professional Radio. My name is Wayne Bucklar, and joining me today is Sandra Thomson. Now, Sandra's the Chief Clinical Officer for Residential and Community Care of PresCare in Queensland, Australia, and she's a Facility Manager for their residential care facility, Alexandra Gardens in Rockhampton. Sandra, welcome to Health Professional Radio.
Thank you.
Now, Sandra, PresCare may not be immediately obvious to listeners. When you put with it the residential care facility, it kind of makes more of a picture, but can you fill us in? What is it that you do and whereabouts do you do it?
Okay. PresCare is a ministry of the Presbyterian Church, and PresCare has been providing aged care services for over 85 years, residential aged care services, and it also provides community aged care services. These services are located from Gold Coast right up to Cairns. There are 6 residential aged care facilities. There's one at Mount Tamborine, there's 2 in Brisbane, there's 2 in Maryborough, and there's Alexandra Gardens in Rockhampton. It's a very innovative organisation, PresCare. Here at Alexandra Gardens in Rockhampton, the residential services that we provide include palliative care and subacute care. And the subacute care program is a program that we introduced in 2014. The reason we introduced subacute care was because of the rapidly expanding population of aged people, and that is associated with increasing preventable presentations to emergency departments.
I see.
In every year, around 10% of people living in residential aged care facilities will be transferred to an emergency department. And those transfers, they're costly, they're stressful for the residents, and they're often unnecessary and unavoidable. So we decided that to avoid those hospital presentations, we would implement this new program, and we've had considerable success. I'll explain firstly what it involves.
Yes, please.
It's a 3-step traffic light system that enables our nursing staff to detect, assess and provide early interventions for 8 common clinical conditions. And these were conditions that we identified were the major causes for hospitalisation at this facility prior to 2014. Conditions include urinary tract infection, delirium, chest pain, dehydration, falls, constipation and end of life. Now, we also purchased new equipment to enable the nursing staff to do more thorough assessments, and that equipment included vital signs monitors, a bladder scanner and an ECG machine. So we now have a skilled nursing service and a confident nursing staff that do have access to the resources that they can use to reduce unnecessary hospital transfers. Now, in the first year, we reduced hospitalisation for our residents by 65%.
Wow.
So our admissions reduced by 50%, and even better, the length of time that the residents spent in hospital was significantly reduced. It was 7.1 days, the average length of hospital stay prior to implementing subacute care in the first year. That reduced down to 5 days. Then last year we reduced that even further down to 3.5 days. So
that's a significant saving to the hospital system, Sandra.
Absolutely. And when you look at the total hospital days, in 2013, in this facility alone, we had 427 hospital days. That was reduced in October last year down to 100. So that's a huge...
spectacular result, isn't it?
Yeah, absolutely.
Congratulations.
Thank you. So there are benefits for our residents and their families. They don't have to go through the disruption of going to hospital, and when residents go to hospital, they feel lost and lonely. It's got benefits for the hospital system because it reduces demand on already stretched resources, and benefits for the staff because the staff have got the confidence, they're skilled, and they're happy.
I can believe that, and I'm very impressed with those figures. Sandra, a lot of our listeners are clinicians of one kind or another, both in your section in aged care, but also in acute care, and some general practitioners as well. What's the message you'd like them to take away today as a result of having heard you on the radio?
We can do great things in aged care. There is a misconception, I think, in the community that aged care is not interesting, it's mundane, and staff prefer to work in the acute sector because it's more exciting. I came to work in aged care 9 years, 4 months ago, for 12 months, and I'm still here. I'm still here because it is extremely rewarding, and some of the results that we've been able to achieve for our residents are highly motivating.
Yes, I can believe that. Now, Sandra, in every interview there's my favourite question, and it has to do with misconceptions. What's the biggest misconception amongst your clients, customers, patients, colleagues that drives you nuts and keeps you awake at night? That
aged care is the poor cousin to acute care. That is not the case at all. It's just as important. When the residents arrive here, we're planning the care for the rest of their life. And we need to provide the best care, the best quality care, and avoid any disruption to the care that they need.
And I can understand why that would be an issue for you. And let's hope that today we've been able to dispel a little bit of that amongst our audience at least. It does sound like you've achieved great results and that it's an exciting environment to work in.
It is indeed.
Now, my guest today is Sandra Thomson, and Sandra is the Chief Clinical Officer for Residential and Community Care of PresCare and Facility Manager for the residential care facility Alexandra Gardens in Rockhampton. Sandra, I do appreciate your time today. Thank you for being with us. If people want to get in touch with you, is the website the best place to go?
Yes, indeed. Yes.
So that's www.prescare.org.au. Now, the good news is, if you've missed my chat with Sandra today, we have some good news. There's a transcript on the website, on our website, that you can read. There's also an audio archive, both on SoundCloud and on YouTube, and you can connect with all those resources at the Health Professional Radio website, www.hpr.fm. My name is Wayne Bucklar, and you've been listening to Health Professional Radio.